What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, a flu test, a test for RSV, or any other virus, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, October 16th, 2024. If you're new to my channel, welcome to my channel. This is where I do the virus update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there. You need to know what's going on with each and every one of these viruses. That's what I do here on my channel. I inform you of the levels of what's going on with these viruses, such as COVID. COVID is probably the most important one that we talk about. Well, it is definitely the most important one. And plus, we talk about complications of COVID. You know, things that can happen after you get a COVID infection. We're actually going to talk about a big one today that probably many people don't even realize is being caused by COVID. If you clicked onto this video because you maybe saw the title, which is going to talk about a post-COVID issue, you're probably clicking on to maybe get some answers. Don't worry, I'm here. I can help you with maybe some of those answers because we talk about different COVID studies all the time. So if you're new here, want to be informed on the levels of COVID and other viruses, or maybe you just want to know what the heck is going on because the news, the media, the government have all stopped talking about COVID and other viruses, hit that subscribe button down below. If you enjoy this video, give it a thumbs up, hit that notification bell, share this video with anyone you know. Of course, leave your comments down below, and I promise I will give you updates as often as I possibly can. Alright, we're going to start off with a few news stories today. Then, we're going to take a look at something. As noted yesterday, I had a doctor's appointment today, for my asthma and breathing. Well, it brings up a great point that I think can really relate to a ton of people. We're going to talk about that for a little bit today. And then we're going to take a look at some of our daily data. We have just a little bit of state data. We're going to take a look at some more Walgreens. And I think we will take a look at some wastewater as well. We're going to see a news story that will lead to us taking a look at some wastewater data in a specific state in just a little bit. Alrighty, stick around for all of that. Starting off with whooping cough. Two stories on that. First off, at Piedmont High School in California. This is in California. I had to look it up because there's more than one Piedmont in the United States. It's whooping cough that is a problem, and it's part of an ongoing problem that is really happening all across the United States. Now, this article is saying 16,000 cases this year. Let's go to another article which is saying an even higher number now. First off, in my area, in the Philadelphia area, we are seeing an increase in whooping cough cases. In fact, just one county alone, Delaware County, Pennsylvania, has now had 182 confirmed cases of whooping cough. This time last year, there was only one case. Yeah, whooping cough is really going up. In Pennsylvania alone, the number is now 10 times higher the previous year. New Jersey is 2.6 times higher. And look at this. Delaware has seen as many as 17 times the amount of cases. But it also says something else here. The CDC recently released new data showing that the number of whooping cough cases in the U.S. rose from 3,260 at this time in 2023 to now. Remember before we said 16,000? Here's a new number. 17,579 new cases so far this year, and the year is not even over. That is a five-fold increase. It could get close to or even go over 20,000 new cases at this point. That is just totally insanity how bad whooping cough is, and how bad the CDC is too, because we have to talk about this. The CDC, I quote retweet the CDC. The CDC finally said the word mask, but look what they're using it. The picture here, a baggy surgical mask. You know the deal. Come on, folks. I should not have to say this. For those who are in the know, it's N95 or better to help prevent COVID and all those other respiratory infections. Here's what the CDC said. The best way to reduce your risk from seasonal flu is to get a flu vaccine, but preventative actions like taking steps for cleaner air or wearing a mask are two additional ways you can protect yourself and others this fall. More at that link. I mean, the fact they're even saying the word masking and clean air, hey, that is a big step. I just wish they would have used a picture with a, one of these N95 mask. All right, taking a look at this. Vermont. This is part one of looking at this. We will take a look at Vermont's wastewater. Yes, that's the state I was talking about. New CDC data finds high levels of COVID-19 in Vermont wastewater, and we know this particular summer wave did hit Vermont really hard. Their cases had to be far higher than what was reported because they were reporting an unusually high number of deaths for the state of Vermont. Now, we're talking about under 10 deaths each week, but we're also talking close to 10 deaths each week, which for little old Vermont, which is not a terribly big state when it comes to population, that is a high number. And it says here, a new wastewater surveillance study of COVID-19 by the Centers of Disease Control and Prevention suggests that there are high levels of the virus in Vermont. Many different reasons for it. It's a colder state. Vermont gets a lot of tourism. You do have a lot of resort towns. I mean, all times of the year, you're dealing with tourism. It used to be the ski season. That was the big time of the year for Vermont. But I'm hearing reports saying, they just had leaf peeping season. And we're probably coming near the end of it for Vermont now because the leaves have peaked there. They're going to start falling soon, right? Well, I'm hearing estimates saying that leaf peeping is actually a bigger draw of people than ski season now. And I'm hearing even summertime, there can be big crowds, places like Stowe, Vermont, Burlington, all the big places that people, well, Stowe's not a big town, but they get a heck of a lot of people going there. So, yeah, it makes sense why wastewater could potentially stay high there for long periods of time. In a little bit, we'll take a look at wastewater there. Alrighty, moving on to this. We talked about this yesterday. It is worth repeating. Last week, the United States, yes, in October of 2024, when the media doesn't talk about COVID much anymore, when you were told it's endemic, when the government stopped talking about it, when you were told it's all fine and dandy to go live your lives, we added another 1,189 new COVID deaths. Just thought you would like to know that, in case you did not. I had a doctor's appointment today with my pulmonary doctor's office, and I saw the PA. And we went over a pulmonary function test results that I had last week. It's not my first one. It's a routine thing I'm going to have to do each year because I am on, in case you did not know, many are new to the channel. Welcome to the channel. If you're new to the channel, I do take monthly, every 4 weeks, injections of Exolar for asthma. Prior to 2020, prior to COVID becoming a thing, I did not have asthma. I did get sick in early 2020. Well, we are starting to find out something about that. And I had to repeat that story today to the doctor because we're starting to put 1 plus 1 is starting to equal 2. It's starting to connect the dots. I'm starting to get answers. And one thing that stuck out on the pulmonary function test was something that did not change from last time. Prior to that, my pulmonary function test was much improved from last time because of Exolar injections and taking Breztri, which is an inhaler I take every day. But things have improved. But one thing does stick out. I have an unbalanced diaphragm. I want to say that correctly. Once again, unbalanced diaphragm. That can be caused by many different things. You can see here, we just Googled it for you. And it shows a bunch of different things. Autoimmune diseases, stress, anxiety. But the one thing I was told that could have caused it was illness. Because, again, I had an unconfirmed case of COVID back in 2020. I explained, that's really when my issue started. It was all the classic symptoms. And we both agreed, yeah, it's very likely that it was caused by COVID. And not only that, she went on to say that we're constantly learning new things about COVID. We're always showing new studies here on the channel, and that even the doctor's office itself, the doctor himself, actually conducted a study to find out about respiratory issues post-COVID, and is finding that this is something that can happen. So here are some of the symptoms of a diaphragm imbalance, and here you go, shortness of breath, low oxygen levels, heartburn or acid reflux. I've had that a couple times. Reflux, coughing or difficulty swallowing, chest pain or tightness, headaches, hiccups that don't stop, pain or pressure in the chest, backside, shoulder, and some other things. I'm sure there's more things than what are being shown here. Here's a study. Take a look at this. I just quickly did a Google search. This is getting added to my website, datareport.info. I quickly did a Google search, and sure enough, diaphragm dysfunction as a contributor to breathlessness after COVID-19 infection. And we're not going to sit here and read the whole study for you, but sure enough, yes, you can put the two and two together, and maybe you're having breathlessness post-COVID. It doesn't hurt to go to a doctor and have it looked at. And it's one of the things I do have in my notes for today. Let's get to these a little early today. If you have an issue post-COVID, talk to your doctor. If your doctor does not listen, find one that will. And that is very true, because when I started with this issue, I was seeing a primary doctor. Well, actually, it was a PA. And the person said, at the time I was 31, I guess we'll say. I'm 34 now, so yeah, 31 I think it was. You're 31 years old. There should be nothing wrong with you. I don't know what you want me to do. That's when I said, you know what? The heck with this. There was another doctor that I went to years before. Didn't continue because he switched offices. I found him again. Guess what? He got me on the ball rolling. He got the ball rolling for me. And because he got the ball rolling for me, he referred me to this doctor, and I said, okay, I'll go to the pulmonary and sleep doctor. Let's get this checked out. I want answers. And, well, here we are, about a year and a half, almost 2 years later with this doctor, and guess what? I'm getting answers. I'm finding out that I have an unbalanced diaphragm. Of course, I had moderate to severe, we can say it. I had moderate to severe asthma. I still do, but I wouldn't say it's severe anymore. It's much more controlled than what it was. But my point is, if you are having any new problems post-COVID infection, whether it be respiratory, whether it be brain fog, dizziness, heart problems, heart pain, high blood pressure, walking problems, any type of post-COVID problems. Number one, that's a form of long COVID. Number two, please do not hesitate to go to a doctor. Maybe check and see if there's a long COVID clinic near you. If you have one, check it out. They can help you. Please get some help. Now, I'm going to be completely honest with you. I'm just one person. For every person, everything is different. Some people will not recover. Some people, their problems will continue. Some people, their problems will reoccur. I know in the summertime when the air quality was bad and the heat was bad, that's when my issues showed up most. And that could be the case for you. All right, moving on. We do have several things to get through. First off, some data from CJS 83172, Florida. 633 new cases. New Jersey, 886 new cases spanning the past 4 days. -1 death. Don't know what that's all about. New York, 476 new cases, the lowest single day total since about mid-spring. Virginia, 2,142 new positive tests, 2 new deaths. Info coming from their VSR dashboard. Maine, 367 new cases and 2 new deaths. But again, I'm not going to be able to say this enough. I'm going to say this more in future videos. If you're having a problem post-COVID, it does not hurt to get it checked out, especially if you have really good health care coverage. All right, moving on now, we do have to take a look at what's going on with the pollen levels. Pollen levels are at 32% of the country is in low to medium status. You do see there is some orange down in Texas. Taking a look at air qualities real quickly, and you will note, let's refresh this. You will note that there is still some bad air qualities out on the West Coast because wildfires are still a thing. The East Coast is doing better than the West Coast. Eventually this will come up. You know what? We'll just move on. I'm telling you. The West Coast, the wildfires, they are still a thing. There they are. You can see. It's still bad. Slightly better than other days, but there's still a lot of work to be done to get that better. Want to learn more about the climate and weather? You can do that over on my other account, and of course I do have climate data report over on YouTube. I think I'm going to get another video out there, probably not tomorrow, maybe on Friday. We'll see. Either Friday or Saturday is the next planned date for a video on that channel. Philadelphia yesterday had 791 reported EMS incidents, and a live look in at what's going on just outside of Philadelphia. Wow, wow, wow. There's a lot of calls right now. We're seeing seizures. We're seeing dizziness. We're seeing stroke. Just a few moments ago, prior to starting this video, I saw cardiac arrest. I see cardiac emergency a couple times. Yeah, there's a lot of problems, calls right now. And same thing over in Chester County. Again, if you've had COVID, I mean, some of these problems, they can occur post-COVID. Please get it checked out before it's too late. I remember back before I had any treatment, boy, would I get short of breath quite often. All right, taking a look at what's going on up in Canada. Let's refresh this. COVID viral activity level is moderate. Flu A is low. Flu B is not detected. RSV is low at this time. All right, let's take a look at what's going on at Walgreens. And what we want to take a look at is what is going on with the COVID positivity rate. And as promised, I will take a look at a few states we did not look at yesterday. The positivity rate nationally is 17%. Prior week is 18.4%. That's down 1.4%. Total test, 5,249. Prior week, 6,492. Michigan is in the green. Green is a good thing. That means dropping positivity rate. 15.8%. Prior week was 24.9%. Testing, though, is down. 152 versus 193. But hey, your positivity rate went down by 9.1%. That is a legit drop. Idaho, 41.7% positivity rate. Prior week was 30%. That's up by 11.7%. 24 versus 20 test. You are not doing enough testing. Pennsylvania, the positivity rate is 14.1%. The prior week was 15.9%. That's a difference of down 1.8%. Total test, 71 versus 82. All right, we could look at some more Walgreens. We're running short on time, and I did say we would take a look at some wastewater. First off, let's look nationally and see what's happening, because this is really quite remarkable for the fall. Look how low the COVID levels are dropping on wastewater. They are really starting to drop at this time. I mean, check this out. It's saying medium. If this drops any more, we're going to be into the low category soon. That is really impressive. RSV, overall, it has been slowly trending upward. It's still very low at this time. Influenza A, Influenza B is low. HMPV is low. Norovirus is medium, but recently it has started to drop some. Now let's take a look at what's going on in Vermont. And we can see here, in Montpelier, Vermont, like the study showed, it's still listed at high levels. It is dropping at this time for COVID, though, and should that continue, I think it's going to go down to medium soon. RSV, Influenza A, Influenza B, low. HMPV is low at this time. So we can see here, things are not too bad, but COVID is still listed as high. Let's take a look at what's going on in South Burlington. And South Burlington is just being stubborn. Look at this. It's just remaining high for COVID there. The other viruses aren't much of an issue, though norovirus, it's listed as low. The rise is starting to become a little bit more, it's starting to increase. So that's something you have to look at. And we might as well take a look at Essex Junction as well. We can see Essex Junction has dropped at this time. And to be fair, since we just showed the east, let's go out to the west. And we'll just randomly look at, how about we come up here to Sacramento, California. What is going on with your COVID levels? I'm happy to report that your COVID levels are low at this time. This is some great news. And RSV is low. Influenza A, rising slightly. Influenza B is low. HMPV is low. But I do want to raise a big red flag. Norovirus. Norovirus is running high. And if you're in an area with norovirus that high, you need to do a couple things. Masking. Hand sanitizing when you can't wash your hands. And just wash your hands, and please be careful and wipe down surfaces with Lysol. Yeah, norovirus, it's really starting to increase there, so that is a concern. Hepatitis A is not much of a concern at this time. And look at this. I'm happy to report no Mpox for you at this time. All right, quickly, New Jersey for today is reporting 254 hospitalizations, 15 people on a ventilator. Can we try for discharges? No, it's freezing up on us. All right, moving on to New York State. 441 people tested positive. And again, your levels as well are remarkably dropping low. One of the reasons is because of at-home testing is something that is, preventing us from seeing the real number of cases. But let's be real about this. Even with that factored in, levels have really dropped in New York. These are some of the lowest levels for this time of year. I don't remember the last time levels have dropped this low. So we'll have to see how far this keeps going. This is some really good news for the next wave that's eventually going to come. That means things are going to start off really low. And I'm happy to report that. Look at hospitalizations. They're quite similar to where they were at the end of last week, but they're starting off the week even lower. 714 in the hospital, 75 people in the ICU. Yeah, you're not far from going back to the levels of spring. Still about 300 away for hospitalizations, but should this drop continue at this rate, and it's clear, cases are dropping even more in New York State, your hospitalizations will continue to drop. It's quite clear that we're talking about some of the lowest levels for this time of year in New York State and many places around the United States in quite some time. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. I think we'll have another Virus Update again tomorrow, but stay tuned to my X account for that because tomorrow is my next Exolar injection, and it's kind of at a weird time of day. It's at 3:30, so keep an eye on my X page, and I will let you know if there's going to be an update tomorrow. Of course, tomorrow is Thursday, so we'll have UK data, we'll have Ohio State, but again, we may not get to Ohio State if I do the video earlier. Just have to see what happens. If you enjoyed this video, give it a thumbs up, subscribe down below if you're new, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. And again, remember, if you are having any new health issue, post-COVID, chest pain, shortness of breath, trouble sleeping at night, dizziness, heart problems, anything, I mean anything, do not hesitate to talk to your doctor about it. It is very important. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening. Thanks for watching.